it's 11 a.m. here in Seoul. Here at Arirang News Center, we're cutting into our regular programming to bring you a live coverage of the South Korean health authorities on the COVID-19 crisis here in the country. In just a few moments now, we're going to go into the Sejong Government Complex where Director General Yoon Tae-ho of Public Health Policy will be giving us the latest figures and updates on the COVID-19 situation here in the country. So we're just going to do that now. We're going to go into the briefing room where the public health officials will be situated, and we will soon go in there and Director General Yoon will be telling us how many infection cases there have been over the past day, as well as the latest death toll. And he has taken to the podium now, so it looks like the briefing's just about to begin.
We also have sign language translation available. First of all, here is Mr. Yoon Tae-ho on the briefing for the coronavirus outbreak. Let us now begin our regular briefing for April 22nd, Wednesday. As of today, midnight, we have a total of 11 new patients and 2,179 are in quarantine under treatment. And we have 238 fatalities right now, and with one more additional death as of yesterday. And I send my deepest condolences to those who have passed away and the families. And out of the 11 new cases, 5 have been reported here in the country, and there were 6 imported countries. And 2 of them were reported at the airport quarantine, and 4 have been reported at the community level. And all of the 6 are Korean nationals. This morning, Prime Minister Chung Se-kyun convened a KCC meeting this morning to touch upon the issues of K-quarantine model measures, as well as measures for the agricultural produce of here in Korea. And he said that we have a stabilizing condition of the outbreak, but we cannot let our guards down because we still have a higher risk of any cluster infections that can occur at any time. However, he stressed that we need to recover our economy as soon as possible. And he also thanked the local municipal governments as well as the home shopping channels for participating in the government's efforts to stabilize the demand and supply of the agriculture produce. And regarding this, the Agriculture Ministry is currently trying to provide any kind of help to the farms as well as floriculture industries. And the ministry is also providing and selling the packages of organic produce here in the country. And the ministry is also producing 22 new hiring offices for the people who will be working at these farms to help the recruitment of the personnel down at the regional farms. And centering around farms and the locally produced agricultural goods, we are currently having more PR of the online sales through SNS and other kind of platforms. And moreover, in order to recover the supply and demand, we are currently having drive-through sales of these produce, as well as the other sales platforms that have no face-to-face contact among people. And the government is going to continue to provide any kind of support that are needed to be provided to these farms and farmers and fishermen. And the following is about the Intergovernmental Working Level Task Force. And in order to share our K-quarantine lessons, we would like to share them with the rest of the international community, and we have decided to establish a new intergovernmental task force to tailor these needs. And this task force team will be conducting web and webinars as well as video conferences with other countries to help Korean government to share our know-hows with the rest of the world. And during the past few days, we have seen our daily increase of the newly confirmed cases to hovering around the 10th. And we know that the global pandemic is still prolonged in the international arena. And as we expect the process of the development of vaccines and therapeutics will be prolonged, we believe that this outbreak will also be prolonged. And until the very end of the coronavirus outbreak, when we have the vaccines and therapeutics, we will have repeated infections. And many experts here at home and abroad expect the outbreak to last about 2 years. And it is very difficult for us to go and to live our lives just as we did in the pre-COVID-19 days. And we need to continue to practice social distancing in our everyday life. And in order to prepare for the prolonged outbreak, the government is trying to make measures so that we can transition ourselves to the everyday life quarantine guidelines. And we are preparing this measure step by step. The everyday life quarantine guidelines include those that need to be kept on a personal level and also by the community as a whole. And for the personal hygiene measures, we will have 5 major goals and also 4 sub-goals. And these will include staying at home if you feel sick, and also having physical distance among each other, and coughing etiquettes, as well as twice daily ventilation, and also keeping the psychological distance near while having a physical distance far apart. And as for the society, we also have guidelines that range from wearing face masks and having good daily conditions as well as daily lives. And these look very simple. However, we have exerted our full efforts and mustered all of the efforts and strength by the experts. So it is very important that these are kept well by the public. And please read through them if they are rolled out. And today, as we need to also address the curb of the further any outbreak here in the country, we will be rolling out our guidelines on the social distancing measures. And these include the measures that will need cooperation on a community level, and to make quarantine guidelines on a community level, as well as cooperating to full extent with the quarantine authorities. And more specifically, the quarantine authorities will have a designated responsible employee who will be responsible for the quarantine measures. And this is to be abided by each and every one of the community. And this designated person needs to go over the screening of the temperatures of all of the people who are working there and who are members of this community. And we also gathered our experts' opinion, and however, the experts said that it needs to be more explicitly elaborated, and that we need to also be systematically ready to implement these measures. And to this end, we will be ready to explain this very clearly to the public as soon as possible. They will be available through the homepage of the KCDC, and also will be rolled out to the public and distributed to the public as soon as we are ready. And moreover, we also have quarantine guidelines for public use facilities, including public transportation, restaurants, and so forth. And they will be provided by each and every one of the ministries and will be distributed to the public as soon as possible. Social distancing measures, which was something that's very new to us, entails the efforts of the public, and I continue to ask for your cooperation going forward. And aside from the everyday life quarantine guidelines, the government has been implementing the social distancing campaign until May 5th. And it is too early to say whether or not we can transition ourselves directly to the everyday life quarantine after May 5th. And we will decide this on a later phase considering all of the conditions. So we ask the public to abide strictly by the self-quarantine measures as well as the self-hygiene measures, and please open up to the opinions of the government's authorities. And I know for sure that the weather is getting nice and that many people are heading outside. And especially from this week, we will open some 200,000 sports facilities nationwide, and the public can also take use of the national forest parks and botanical gardens. And during the holiday, during the end of April to early May, we believe many people will be heading outdoors. However, we also continue to urge the public to refrain from any unnecessary gatherings until May 5th. And if you go on an outing, please refrain from dining together with large groups of people indoors. And please keep a physical distance of 2 meters so that there would be a lower risk of droplet infection. And also abide by personal hygiene measures when you go to crowded place. Even at this moment, as we speak now, many people are enduring inconveniences and they are complying with the social distancing measures. And there are still many medical practitioners who are fighting on the front lines to combat the COVID-19. And also many government officials are spending sleepless nights at the central government and the local government level to prepare for our battle against the COVID-19. And this also is a time where we experience the value of cooperation in our social distancing campaign. And this is something that cannot be done by individuals, but only can be done through collective efforts. And we know that many people are enduring difficulties, but if we also continue to cooperate going forward, we can overcome this crisis. Thank you very much.
Well, that was a live briefing that we just heard from South Korean health authorities updating us on the latest COVID-19 figures and statistics. Well, we just heard that there were 11 additional infection cases in the country, bringing the total to 10,694. And unfortunately, there was one more death, bringing the total death toll here in Korea to 238. Well, that concludes our coverage of this morning's briefing. We're going to be back in just a little while, though, at 12 p.m. Korea time with our regular midday news. Bye for now.